Hi, I'm Louis.
And I'm Ben, and we're from Tropika Club Magazine.
So today we are actually going to talk about ivermectin. What's that?
So I think it's been trending nowadays. We probably, some of us have seen some of the news. So it's actually mainly used as a horse dewormer.
Horse.
Yeah, horse,
Okay.
not house. So it's a medication that helps treat the parasitic worms inside animals.
Okay.
So that is its main use.
So what is it trending recently about?
Oh, so apparently there's a 65-year-old retiree in Singapore who ingested it, I think if I'm not wrong, 3 or 4 tablets. Yeah, over 2 or 3 days.
When it's for horse?
Because I think she was persuaded by some of her friends.
Okay.
Yeah. So, and then she ingested it and then she got sick. So apparently she had high fever. It was gone up to 39.3 degrees Celsius.
Okay.
And then when she ate, she was vomiting violently. So her family thought that, it was a side effect of the vaccines, but I think it got so bad that they had to call bring her to a hospital. Then they realized that she actually took ivermectin. Yeah.
Oh dear. So seems like actually this drug is actually pretty harmful to humans. Actually, is it just specifically more official for animals, animal treatment?
Yeah, so it's mainly used in animal treatments, but in America, the FDA has approved it to treat certain parasitic worms as well. So, for example, there are certain types of diseases in humans that you can use ivermectin for, but because humans and animals, the physiology between the two of them is totally different.
Yes.
So that's why people, when they buy the ivermectin, they don't know if it's for humans or for animals. Yeah. So for animals sometimes they have higher doses, right? Because for example, horses.
Why do you keep thinking of houses today? Are you buying a house lately?
Because I want to think of a better future when I have a house. I don't need to worry about ivermectin. But anyways, horses. So because horses, they are bigger animals than us humans, right?
Yeah.
So that's why the doses are higher. So that's why when people take those that are created for animals, they fall sick very, very badly. So in Malaysia also, there's 2 cases as well. There was this one older guy who ate already and then is eat until unconscious, and another 35-year-old who also ate it was also found to be seriously ill. Yeah.
But seems like because of this 35-year-old guy also, after he took it, because it's an anti-parasitic drug, that he actually suffered through acute poisoning also.
Yeah. So I think the Malaysians the drug authority is said that it's don't use it.
Yeah. I think another guy was actually found unconscious.
Yeah.
But
Yeah.
actually, how is he now?
Huh?
Is there any updates?
I don't know. So far I couldn't find any more updates,
dear.
but let's hope he's fine. Yeah.
So I think in the gist of it, just don't take drugs not prescribed for you, or just go self-medicate yourself. Always seek professional help.
Yeah, and always most of the time, when for example when the vaccine just come in, we don't know the research if it's effective or not. That's why people do clinical trials. That's why people study it. So for ivermectin, so far the studies have been very inconclusive. There's no very strong case for it to be used in humans just yet. Yeah.
Yes. So even from the Singapore Health Science Authority, the HSA, they also said that there's no scientific evidence from properly conducted clinical trials, to prove that this medicine is effective against COVID-19. So definitely don't take this drug just to feel that it can prevent and treat COVID-19.
Yeah, so the developer of the drug, this company called Merck, MERCK. So back in February, they were like, no, don't use it. So even the developer of the drug asked you to don't use, you better not use it. Yeah. So I think if I'm not wrong, I also saw this tweet which was very funny. It was by the Food and Drug Administration back in America. They was you all are not horses, you are not cows. Seriously, stop it, y'all. So it's it takes until that kind of level of.
But I'm actually curious, how did this drug actually get to the humans? Or rather, how did even humans find out about this drug to treat themselves?
Yeah, so actually, calls to use ivermectin really started quite early on in the pandemic because, back then it was quite chaotic. We didn't know how to treat the disease. So everybody was just desperate to find a way to cure COVID, and then to prevent deaths from COVID-19. So that's why doctors tried a bunch of different drugs, a bunch of different treatments, and then ivermectin was one of them. So there was this study back in quite early on in the pandemic, and then in Australia, so the study was done in Australia, and then they tried using ivermectin on cell culture. So it was in a laboratory setting, so it was very controlled, and they only use cell culture. They didn't use it on humans. So when they tried it, and they thought, it stopped COVID from replicating inside those cells. But it was done in a laboratory setting, and there were a lot of scientists and doctors that really hesitated to extrapolate and or explore further, because they said that they thought that because if they brought it to human trials, it means they have to increase the dosage to a highly damaging level, which would harm human beings.
And definitely we wouldn't know the side effects in the long run.
Yeah, exactly. So that's why there was still some people that will still wanted to try, because they have places in settings where in prisons, right, where the COVID-19 was spreading very rapidly. So the doctors were also still trying to find a way, and people were desperate. So, and then it doesn't help that ivermectin is actually quite cheap. So that's why it can easily transmitted, not transmitted, like easily distributed. Not transmitted. We have enough things transmitting now. So actually in the United States, there was this group called the Frontline COVID-19 Critical Care Alliance. Long name. So there's this group, right, that keep proposing ivermectin to be used in patients. COVID-19 patients, because they were the group that discovered that steroids was actually effective and can treat COVID-19. So that's why people listen to them, but somehow they latched on to ivermectin now. So that's why in the US, their Food and Drug Administration really put out that tweet, and it's even the sort of this kind of sensation even spread to Singapore.
But it's actually stated specifically created for use on animals to prevent heartworm disease. As well as combat internal and external parasites.
So it's mainly to treat parasitic worms. So it's not COVID. Is not a parasitic.
Is COVID parasitic now? I don't think so.
It's scary. It's as scary as parasitic worms, but it's not parasitic worms. So actually, there was a lot of studies done. Actually, in November 2020, there was a major study in Cairo, in Egypt. So it explored the use of ivermectin in humans. So that's we think also how it sort of picked up steam. So because it showed that it could potentially be effective. But again, the World Health Organization already said that it's not effective, so there's not enough scientific evidence. So back in March 2021, so the World Health Organization said that the current evidence on the use of ivermectin to treat COVID-19 patients is inconclusive. So until more data is available, the WHO recommends that the drug be only used within clinical trials. So again, the World Health Organization, the developer of the drug company itself. So there's a lot of even Singapore's Health Science Authority also already put out a statement saying that don't choose ivermectin.
Because from all the case study, whoever has taken it didn't help at all. They got into even worse situation or even death.
So if you want studies that have been done closer to home, so last year, right, the National University Health System, there's a team of clinician-scientists. So they actually go and they were doing some studies on migrant workers in May last year, when the cases was really spreading among the migrant dormitories. So they tested various therapies on over 3,000 migrant migrant workers, and then 617 of those they actually tried using ivermectin, but they discovered that like it was less effective than the two other drugs that they used, and also like the study didn't find any statistically significant differences in COVID-19 infection rates between those who took vitamin C and ivermectin. So it's like the difference not that big. Then like, you know, you might as well just eat like the vitamin tablet rather than you go and eat like, you know, the ivermectin tablet. At least you know that vitamin C, you know, you go vitamin C gummies, right? Yeah. So, and then like the side effects isn't fun either. It's like vomiting, you mentioned diarrhea, stomach pain, liver injury.
Oh dear.
Yeah. So, and then it can also, like, ivermectin can also interact with other medications like blood thinners and so not fun. I eat my mala and get like diarrhea rather than eat my ivermectin, right? Like, isn't it more fun? Like, if you're having mala, don't take ivermectin, just eat mala. Yeah. So it's like the science will keep changing. Like, even when the vaccines first rolled out, everybody didn't really believe that, you know, the efficacy rates were so high, like 90%, 80%. So, you know, when something new comes in and then we just want, you know, COVID to be over, right? So sometimes I think that we don't want that uncertainty, then we get a bit impatient, and then we just want anything to, you know, stop us from, like, you know, dying from COVID-19. So I think like we just need to be patient.
Definitely.
So I think that's covered probably most of it.
I think that's quite pretty gist of it of this ivermectin.
Yeah, so like don't take.
In summary, just don't take something that it does. Don't self-prescribe drugs to yourself.
Yeah, always get a doctor. So that's it for today. Thanks for watching. I'll see you next time.
Remember to like and subscribe.
Yeah, bye.
Bye-bye.